Bismillahirrahmanirrahim. So today we are going to study about the Barrett esophagus. So what is Barrett esophagus? It is the metaplasia of the lower esophageal mucosa from the non-keratinized stratified squamous epithelium to the non-ciliated columnar epithelium with the goblet cells. It is the metaplasia of the non-keratinized stratified squamous epithelium to the non-ciliated columnar epithelium with the presence of goblet cells. It's seen in about 10% of the patient with GERD, i.e., GERD is the most important risk factor for the development of the esophagus, as I have already discussed in the lecture regarding the GERD, i.e., it is the response of the lower esophagus stem cells to the acidic stress, and these stem cells will cause the conversion of the non-keratinized stratified squamous epithelium to the columnar epithelium. It is mostly seen. It is mostly seen in the white males, and they are typically present in the old people, like at the age of about 40 to 60 years of age. Now, the this built esophagus can also progress to the dysplasia adenocarcinoma, and there are about 30 to 40 fold chances for development of the esophageal adenocarcinoma when the size of this built esophagus is greater than 3 centimeter. It is greater than 3 centimeter, then there are 30 to 40% chances of developing into dysplasia and adenocarcinoma. So the patient which is diagnosed with the Barrett esophagus usually undergo surveillance endoscopy and biopsy to monitor for the development of dysplasia or adenocarcinoma. Now, morphologically, we can see that there are tongues or patches of red velvety mucosa, which is also known as salmon pink appearance on the gross picture, and this is mostly seen on the endoscope. And microscopically we can see that there is metaplastic glandular epithelium with goblet cells, which has been which is due to the conversion of the non-keratinized squamous epithelium into the glandular or columnar epithelium. We can also see the inflammatory cells, and it is mainly lymphocytes and the plasma cells. Now, this Barrett esophagus may have low-grade dysplasia or the high-grade dysplasia. Low-grade or high-grade dysplasia. Now, how to differentiate between the low-grade and high-grade dysplasia? So, whenever the columnar cell nuclei are basally located, so it is a low-grade dysplasia. But when they attain a typical orientation, that is a part of what? High-grade dysplasia. Here you can see the gross endoscopic view of the Barrett esophagus. This is the salmon pink appearance of the Barrett esophagus, and also here you can see that there is a non-stratified columnar epithelium, non-stratified squamous columnar epithelium, and there is an abrupt change from the non-keratinized to the what? Columnar epithelium having the goblet cells consist of mucin. These are all goblet cells, and this is squamous non-stratified squamous epithelium. So that's all for today. Thank you. Jazakallah.